Hello, and thanks for joining us today. I am April with Lakeland Mom. I am talking today with Lakeland Regional Health about what to expect right now in the emergency department. Last week we talked about labor and delivery, and this week we have another topic that we think is of importance to our community. So with me today, I have Dr. Timothy Regan, who is the President and Chief Medical Officer at Lakeland Regional Health. He is also an emergency room physician. And also with us is Joanne. Joanne, how do you say your last name? I should have asked.
Fuell. Yes. Yeah.
And Joanne is the Assistant Director of Nursing over Emergency Services, and she oversees the Children's Emergency Department. So hello to both of you, and thank you. First off, a huge thank you to you and your entire staff for keeping our community safe and healthy. I know both of you and all of your staff are working under very stressful conditions 7 days a week, and as a community we appreciate that. Personally, I'm really proud to partner with Lakeland Regional Health to spread the word about important healthcare topics in our community. So with that, let's talk about the emergency department. I have heard, and many others have as well, and read that people are afraid of coronavirus, of COVID-19, and are avoiding coming to the emergency department to seek urgent care that they really need out of fear of contracting the virus or being exposed to it. So what are you seeing right now in the Lakeland Regional Health Emergency Department as far as numbers go and how that's changed?
Do you want to start, Dr. Regan, or?
Sure. Our volumes are down approximately 40 to 50% depending on the day. Typically, our emergency department sees anywhere from 600 to 750 patients per day, especially this time of year. And we really have been running around the low 300s, upper 200s, which is a very unusual phenomenon. From what I'm reading, it's not unique to Lakeland. This is a global phenomenon, at least a national phenomenon, but I've also read that it's a global phenomenon where patients are trying to avoid, any type of medical setting, not just hospitals, but physician offices as well.
And to be fair, emergency departments, we're not used to not being as busy as we normally are. So it makes us feel a little bit uncomfortable because we know that potentially maybe there's portions of the population that don't feel comfortable coming to us. So that does make us feel very uncomfortable that there is that persona perception out there.
Right. I understand that completely. So one of our goals today is to help spread the word about what you have in place so that people aren't afraid to come to the emergency department. Can you talk, I know, again, from the information I have, that you've done a great job of really separating the campus. And can you talk a little bit about the precautions you've put in place over the last few weeks?
I think that with the executive leadership team that we have at this organization and the whole team, the organization's worked really hard at putting precautions into place. And you'll see those precautions, as soon as you kind of enter the campus at any avenue, any entry point. That initially we start people screening to make sure that that you are appropriate, that you are okay to come to us, that we want you to come to us. But we start those screening questions to make sure that if you are somebody that has a fever or a respiratory condition, that we can safely take care of you in this avenue. And if you're not, that we can safely take care of you in that avenue. But the ultimate thing is that if you are sick at home, we do want people to come to us. It's very, very safe. And we start those screening questions, those screening procedures as soon as you set foot on our campus at our entry points.
Dr. Regan, how about, I know you've really separated patients that have COVID-19 or even have COVID-19 symptoms from those that are coming in for all other issues. Can you talk about that, kind of that setup?
Sure. Just to tag on what Joanne was saying, as soon as you come to the medical center or to the physician practices as well, you are being screened for symptoms and we're taking your temperature. From there, depending on what your complaints are and where you fall in the screening process, we really have gone through great lengths to separate these patient populations into potentially COVID positive and people who just don't screen as potentially positive. We are blessed to be as big as we are because we really have the ability, due to our size, to separate the medical campus into essentially two campuses. So our ER is 133 beds that we have split in half. Our medical center is 864 beds. And we've gone to the point where we have evaluated our air handler systems, and we will place these different patient populations so that they're not even breathing the same air as each other. We really are doing our best to give the community confidence that this is the safest place for them to be, especially if they're sick.
Yeah.
Joanne, for anyone who's watching who hasn't been to the new Children's Emergency Department, can you talk a little about its location and how it's actually in a separate building?
Sure. Yep. It's a beautiful building, and we're very proud of that building. It's specifically built with children in mind. So again, as you enter the department, you can see it's nice big open spaces, which again, when you're talking about COVID, helps with that whole screening process and the social distancing. But it also injects a playful area for the child, because again, we want this to be a less stressful experience for the child and the parent. But it is separate. It's still connected to the campus, but it is separate. It's on the other side of the campus from where the main ER. So for many of you who have been here many years and used to come into the old ER, you exactly know where that is. But essentially, it's just off Lakeland Hills Boulevard. It has its own entryway. It has adjacent, like right outside the door, visitor parking, patient parking. So you can park your car almost very close, right outside the pediatric emergency department. There's a lovely, big, bright children's emergency department sign, so you hopefully you can't miss it. And then literally you just park your car and you just get out your car and you walk straight into that whole nice big open pediatric specific triage area where we're going to screen you for all those COVID questions and pop you in the right location.
Obviously, there are people who come in by ambulance. If it's a true emergency, we want people to call 911, come by ambulance. But there are certainly other issues where a parent or a family member might be driving someone to the hospital. So you have this emergency call ahead number, which is 863-687-1414. And we will put that with this video as well. But can you talk about that, kind of what people can expect and why you put that in place?
I think it was another layer to help with help our community, to help them feel, confident in, coming to the emergency department, to help them feel that they didn't have to wait in a triage area, to help them, really have that confidence coming back to the ED. We don't want any person that's sick sitting at home thinking that they can't go anywhere because they're scared of getting COVID or being exposed to the coronavirus. We want patients to feel safe. So this was another layer that we added in for our community, and we're very excited about that. So they call that number. They speak to a concierge type person who is an RN, so it's a clinical person. They're going to ask them questions as to hey, what's going on with you, how can we help you, and then once we get all that information, we'll also actually we'll liaise a time with them. They can come right now, or they can come in an hour. We'll set them up a time to come to the emergency department. They call us when they park their car, and then we will also have a liaison go outside the emergency department and meet them, and then we bypass the whole of the triage areas is what we do, and then we direct bed them to the appropriate location. So it's adding that another layer of confidence, we hope, for our community, in trying to get those sick patients, who typically would come to us on a normal average day, who are too scared to do that. And we want those patients. We don't want patients sitting at home getting sick and getting sicker, which not just impacts themselves, but also their family and their family members. So we just literally implemented this about a week ago, and we're very excited by that program.
Dr. Regan, I assume in the adult emergency department it works similarly?
Yeah, absolutely. And, like Joanne said, we were meeting patients out in the basically the parking area, escorting them to their room. And patients should understand that as long as they screen negative for COVID, they will be in a separate part of the emergency department. And that is the same for our pediatric emergency department. So our emergency department is, in peds, we have a pod-based system. And so there are separate pods for patients that screen positive and separate pods for patients that screen negative. The staff are all highly trained as to how to use personal protective equipment, and and we understand how to separate these patient populations.
We talked kind of before we started filming too about some of the symptoms and symptoms that concern you, symptoms that are indications of life-threatening conditions, stroke and heart attack. Can you talk a little about the symptoms that concern you, or the maybe cases that you know of where people have delayed treatment and it's been unfortunately fatal or created a bigger issue for you in treating people?
Sure. Just on behalf of the medical staff here at Lakeland Regional, it's been sad to hear some of the stories that we are hearing in the community. We've had, young people in their 40s sitting at home with chest pain that were likely having a heart attack that ended up coming to the emergency department at the last minute, either in a code status and eventually dying. We have heard stories of older people who have fallen, who are unable, to walk, who likely had a broken hip. But with broken hips, that can be an emergency for elderly people because you develop blood clots and deconditioning. Strokes that have gone not unrecognized, but just out of this profound fear of leaving the home and coming to the medical center. Really, people in the community should understand chest pain is nothing to take lightly. Severe headaches that don't go away, altered mental status or changes in speech, even abdominal pain or stomach pain that goes for longer than several hours probably needs to be addressed if typical home remedies don't help out. There are medical emergencies. I know we live in a world right now where people think the only medical condition is COVID-19, but the reality is that there are life-threatening medical conditions that people are probably experiencing that they need to have evaluated.
Right. Something else too I think about, I luckily haven't been to the emergency department in a few years, but I think it's also a misconception that it's going to take hours and that they're going to be there for a long period of time, which obviously there are certain conditions that require people to be admitted when they're serious and require ongoing treatment, but there are certainly plenty of issues that are treated and in and out in a few hours. I think about, when I've been there, it was for a child's broken collarbone, or for myself, I had kidney stones and was very sick. But again, was in and out and got what we needed. And so I hope people realize that as well, that for so many issues that it is, you guys have really, compared to many, many years ago, you do an amazing job of getting people in and out as quickly as possible. And we appreciate that, that effort that's been made over the last 5, 8, 10 years that it's been. On a somewhat separate note, I know I've heard that Lakeland Regional is also preparing to resume elective surgeries on, I think, May 9th.
Yes.
Can you talk a little about that?
Sure. So Governor DeSantis's executive order expires on May 8th. We are in constant contact not only with the Department of Health and the state medical community, as well as the regional medical community, just to keep an eye on if that date will continue to stand. So we are preparing for the expiration of that executive order on May 8th, and so May 9th, we will resume elective procedures. With that, there will come several new screening mechanisms to make sure that patients are safe. Will be requiring that everyone who has a procedure done here will get a COVID-19 test in some capacity. So typically, most of the health systems in the region do not have the ability to do same-day testing. It is still send-out tests, and we will be requiring that. And so people who need to have elective procedures done, they need to get in touch with their physicians. And then part of that, there will be an added layer of screening to make sure we know the status of the patient, regardless if they're COVID positive or COVID negative, because we want to make sure that other patients within the vicinity are safe. We want to make sure that we can divide the ORs, and we have a large OR suite where we can separate the ORs, and we want to keep our staff safe as well. We've been lucky where we have not had very many team members test positive, and we have a process for that, but we really want to make sure that our teams are safe.
So as far as questions I have, that's about it. If there is anything else that you would like to share with the community or information we haven't covered, I'd love for you to share any final thoughts you have.
Sure. I mean, you talked a little bit about the ER and our efficiency. This is something that people in the community may not recognize or may not have heard how world-renowned Lakeland Regional is for how efficient our emergency department is. Our goals are to have a patient evaluated and either sent home or admitted within 3 hours, as long as it's medically safe. But our average is, I think, somewhere around 2 hours and 10 minutes. So people should understand that there's very little wait in the emergency department, and these days, with volumes being what they are, and because of what we've set up to separate patient populations, we are putting people in beds. They are seeing physicians, within 15 minutes or so by the time they arrive, and they're usually home within 3 hours, as long as they can go home. And if they're not able to go home, we're able to care for them, within the medical center. So, I lose track sometimes because we talk about it all the time at the medical center, but how much people in the community know how much we've changed over the last 10 years since I've been an ER doc here. The other thing, there are a few other items that I think the community should understand. We do have a respiratory clinic in the community. It's at our Pablo campus. This is really designed for people who are concerned that they may have an illness due to COVID, and we have a respiratory clinic there. We also have drive-through testing at the RP Funding Center that we've arranged through the City of Lakeland. You do require an appointment to go there, and that is if you go to our website, which is mylrh.org. You can make an appointment to be just to have your testing there. It's done right in your car. It takes less than 15 minutes. So just a number of ways that we're really trying to keep this community safe, and we want to give people confidence that no matter what their medical condition is, they are safe to have it evaluated here. And we're going through great effort and great lengths to keep the community safe, to keep our team members safe.
We appreciate all of that. And I haven't mentioned that we have a lot of it on the Lakeland Mom website as far as numbers to call, and but the best advice for someone who thinks they might need to be tested, or even if they're coming to the emergency department and not coming in an ambulance, would be to visit your website. And right there on the homepage, there are links to, call ahead numbers and places to be tested and all of that information. So again, we'll include that with this video as well. Joanne, any other thoughts?
No, I mean, I appreciate you allow us the opportunity to come and talk to you today. So thank you very much for that. And I just think that, for the pediatric ED perspective, is that we want to be able to take good care of our patients, and, we want to be able to reach out to the community. So if you have those signs and symptoms and you're going to come to us before coronavirus, please, come in, use the call ahead program. we want to be able to ensure that we're giving that good quality care to our patients and our community, continue to support our community like we've always done. So, we appreciate the opportunity to be able to, speak to you today and try to reassure the community that it's safe to come to our emergency departments.
Just one other thing, understanding that your audience are usually pretty tech savvy and know how to navigate their phones and whatnot. And we've really beefed up our telemedicine offering, which I think is exciting. For this particular generation, the mom generation right now, I think that this is a way that people can be evaluated for minor illnesses without having to leave the comfort of their home. And we do have information about telemedicine on our website as well. But I think that this is really an exciting development in medicine in general. As we're keeping patients safe, but there are a lot of things that can be done through this wonderful technology of video conferencing. So I would encourage people to take advantage of that if they're interested.
Yes, absolutely. And that information is on your website homepage as well. Okay, well, thank you both so much for joining me, and thank you again for all that you're doing and your staff is doing. And with that, we are going to sign off.